Japan has one of the lowest rates of cardiovascular disease in the developed world. Its citizens live longer than almost anyone else on the planet, not just in terms of total years, but in terms of healthy, functional, independent years. The Japanese island of Okinawa was one of the original blue zones identified by researcher Dan Buettner, a place where centenarians are not remarkable but routine. And across mainland Japan, the average life expectancy consistently ranks among the highest on Earth, with cardiovascular mortality rates that are a fraction of what they are in the United States. There are many reasons for this. The diet, the social structure, the cultural relationship with movement and rest. But one specific practice, rooted in Japanese workplace culture, embedded in Japanese health policy, and now supported by a growing body of clinical research published in some of the world's most rigorous peer-reviewed journals, has begun attracting the attention of cardiologists and exercise physiologists in ways that most American adults have never heard about. It is a set of exercises, not dramatic ones, not time-consuming ones, not the kind that require a gym, a coach, or a cardiovascular system that is already in excellent condition. 3 specific exercises, practiced in a specific sequence that research has shown to produce reductions in blood pressure that rival the effects of pharmaceutical antihypertensive medication, in people who do them consistently over weeks and months, starting at whatever level of fitness they currently possess. Today we are going to explain these 3 exercises, the science behind why they work, and exactly how to perform them. But before we do, we need to spend a few minutes on why your doctor probably has not mentioned them to you, and why that gap between what the research shows and what patients are told is worth understanding clearly. The blood pressure conversation in most American primary care settings follows a predictable arc. The cuff goes on, the reading is elevated. A discussion about diet and exercise follows, typically at the level of general encouragement rather than specific prescription. And then, frequently, a medication is added or adjusted. This pattern is not a failure of care. It is a reflection of the time constraints of clinical practice, the training priorities of medical education, and the genuine efficacy of antihypertensive medications that make them a reasonable first-line response. But here is what that conversation almost never includes. A precise, protocol-based exercise prescription calibrated to the specific mechanism through which exercise lowers blood pressure, a mechanism that is now understood in detail sufficient to design exercise protocols that target it with the same specificity that pharmaceutical drugs target their molecular receptors. The research on this exists. It has been published in major cardiovascular journals. It has been implemented as health policy in Japan, and it has produced clinical results that most American hypertensive patients have simply never been offered. The 3 exercises we are about to describe have their deepest roots in a Japanese practice called Ragyo Taiso, radio exercises, a national morning exercise program broadcast on Japanese public radio since 1928, practiced by millions of Japanese adults every morning, that combines gentle range of motion movements with rhythmic breathing and light muscular engagement in a way that produces cardiovascular benefits far exceeding what the modest intensity of the movements would suggest. But the 3 specific exercises we are focusing on today draw from a more targeted research tradition, the work of Japanese exercise physiologists who have studied, with clinical precision, which specific movement patterns most effectively reduce blood pressure in hypertensive older adults. Let us begin with the biology, because understanding why exercise lowers blood pressure, specifically, is what makes these 3 exercises comprehensible rather than arbitrary. Blood pressure is determined by 2 primary variables: cardiac output, how much blood the heart pumps per unit time, and peripheral vascular resistance, how much resistance the arteries provide to that blood flow. Hypertension in most adults is driven primarily by elevated peripheral vascular resistance, arteries that are chronically constricted, stiff, or narrowed by atherosclerosis in ways that require the heart to pump harder to maintain adequate circulation. The mechanisms by which exercise reduces peripheral vascular resistance are multiple and well documented. The first is the enhancement of endothelial nitric oxide production, the same mechanism we discussed in depth in our blood pressure video. Physical activity mechanically stresses the endothelial cells lining arterial walls through the increased blood flow velocity and shear stress that movement produces. This mechanical stress is one of the primary triggers for endothelial nitric oxide synthesis, the production of the molecule that causes arterial smooth muscle to relax, arteries to dilate, and blood pressure to fall. Regular, repeated bouts of this mechanical stimulus produce lasting upregulation of endothelial nitric oxide synthase, and lasting improvements in arterial flexibility that reduce the baseline peripheral vascular resistance driving hypertension. The second mechanism is the reduction of sympathetic nervous system activation. The sympathetic nervous system is tonically overactivated in hypertensive adults, producing a background of arterial constriction that keeps resting blood pressure elevated even in the absence of any immediate stressor. Regular moderate exercise produces measurable reductions in sympathetic tone through adaptations in the autonomic nervous system that shift the balance toward parasympathetic dominance. The third mechanism, and the one most specifically relevant to the three exercises we are about to describe, is the improvement in arterial compliance. Arterial compliance is the ability of the arterial wall to expand and recoil with each heartbeat. Stiff, non-compliant arteries generate higher systolic pressure for the same cardiac output than elastic, compliant ones, and arterial stiffening with age is one of the primary drivers of the isolated systolic hypertension that is the most common form of high blood pressure in adults over 50. Specific forms of exercise produce documented improvements in arterial compliance through mechanisms that include the nitric oxide-mediated arterial smooth muscle relaxation, the reduction in advanced glycation end products in the arterial wall, and the direct mechanical stimulus of rhythmic pressure wave generation that trains the arterial wall to respond more elastically. With that biological foundation established, let us turn to the three exercises. The first exercise is isometric hand grip training, and I want to be transparent that this is the exercise most likely to seem counterintuitive because the image of squeezing a ball does not intuitively suggest a blood pressure treatment. But the clinical evidence for isometric hand grip training as an antihypertensive intervention is among the most robust and most rigorously demonstrated in the entire exercise medicine literature. Isometric exercise, in which a muscle contracts against resistance without changing length, producing force without movement, produces a specific cardiovascular recovery response, post-isometric hypotension. A sustained enhancement of parasympathetic activity and a reduction in sympathetic vasoconstriction that persists for hours after the exercise is completed. A landmark meta-analysis published in the Journal of the American Heart Association, analyzing data from 11 randomized controlled trials, found that isometric hand grip training produced a mean reduction in resting systolic blood pressure of approximately 8 millimeters of mercury and a reduction in diastolic blood pressure of approximately 4 millimeters of mercury. A sustained 8-point reduction in systolic blood pressure is associated with a 12% reduction in the risk of stroke and a 9% reduction in the risk of myocardial infarction. And this reduction was produced by 4 2-minute sessions of daily hand grip squeezing, 8 minutes of exercise total. The Japanese protocol uses the following parameters. Using a hand grip dynamometer or a soft rubber ball, squeeze and hold for 2 minutes on one hand at approximately 30% of maximum grip strength, rest for 1 minute, then repeat on the other hand. Perform 4 sets total, 2 per hand, in one session. The total time investment is approximately 10 minutes including rest periods. Perform this once daily. For adults who do not have a grip dynamometer, a standard rubber stress ball, a rolled-up towel, or a tennis ball provides adequate resistance. The key is to squeeze at an effort level that produces muscular fatigue by the end of the 2-minute hold, but does not cause discomfort. Approximately 30 to 40% of maximum effort. The second exercise is slow, resonant breathing. And while deep breathing practices have been part of Japanese culture through the martial arts, meditation, and formal relaxation traditions for centuries, the specific protocol validated by clinical research is more precisely defined than most people realize and significantly more effective than casual deep breathing. The exercise physiology of slow breathing and blood pressure centers on respiratory sinus arrhythmia and its relationship to the baroreceptor reflex, the body's primary moment-to-moment blood pressure regulatory system. Baroreceptors in the aorta and carotid arteries continuously monitor blood pressure and signal the autonomic nervous system to make compensatory adjustments. When breathing is slow, specifically at a rate of approximately 6 breaths per minute, which is the respiratory rate at which the breathing cycle is synchronized with the natural oscillation of the baroreflex, this synchrony produces a resonance effect that dramatically amplifies the efficiency of baroreflex-mediated blood pressure regulation. Research published in the journal Hypertension found that device-guided slow breathing, training adults to breathe at approximately 6 breaths per minute for 15 minutes daily, produced significant and sustained reductions in blood pressure over an 8-week period, with average reductions in systolic pressure of approximately 10 millimeters of mercury in hypertensive patients. The Japanese slow breathing protocol uses the following sequence. Inhale slowly through the nose for 5 seconds, allowing the abdomen to expand first, then the chest, in a bottom-up diaphragmatic filling sequence. Hold gently for 1 second. Exhale slowly through the mouth or nose for 5 seconds, allowing the chest to fall first, then the abdomen to draw gently inward. This produces a breathing rate of approximately 5 to 6 breaths per minute, the resonant frequency range most associated with baroreflex amplification. Perform this for 10 to 15 minutes, ideally in a seated or reclined position. The practice produces measurable blood pressure reductions detectable within a single session in many people, making it one of the most immediately gratifying blood pressure interventions available. Before we present the third exercise, here is a pause for you. Have you ever been given a specific exercise prescription for blood pressure, with a named protocol, specific durations, and a mechanism explanation? Or has the advice you received been limited to general recommendations to exercise more? Drop a comment below right now. Your answer helps us understand what the community is experiencing and shapes every video we create. The third exercise is Katsu-inspired low-load resistance training, originating in Japan through the work of exercise physiologist Dr. Yoshiaki Sato in the 1960s, and the subject of decades of Japanese-led research before gaining significant international attention. Kaiatsu training, also called blood flow restriction training in the international research literature, involves performing resistance exercises at very low resistance levels while applying mild pressure to the proximal limb using a cuff or band that partially restricts venous return from the exercising muscle. The partial venous restriction causes metabolic byproducts to accumulate in the muscle, producing a stimulus for muscular and vascular adaptation equivalent to that produced by high-intensity resistance exercise, but at a fraction of the load. For blood pressure specifically, low-load resistance training with blood flow restriction produces documented reductions in systolic blood pressure through mechanisms that combine the acute metabolic stimulus, which triggers vasodilatory prostaglandin and nitric oxide release, with the chronic training adaptation of improved endothelial function and arterial compliance. A meta-analysis published in the journal Hypertension Research found that low-load resistance training with blood flow restriction produced significant reductions in resting systolic blood pressure compared to traditional high-load resistance training, despite using loads as low as 20 to 30% of maximum. The simplified version for home use, adapted from the formal Katsu protocol without specialized equipment, uses a loosely tied exercise band around the upper arm, just tight enough to feel slight pressure but not tight enough to cause numbness or tingling while performing slow, controlled repetitions of simple arm exercises. Bicep curls with very light weights or no weight, slow arm raises, gentle shoulder presses, 20 to 30 slow repetitions per set, with a 3-second raise and 3-second lower tempo, performed for 3 sets with 30-second rest periods between sets. The key parameters are the low load, no more than 20 to 30% of maximum, the slow tempo, 3 seconds up, 3 seconds down, and the continuous tension without locking out the joints. A study published in the Journal of Human Hypertension found that low-load, slow-tempo resistance exercise performed 3 times per week over 8 weeks produced significant reductions in both systolic and diastolic blood pressure in hypertensive older adults, with effects comparable to those produced by moderate-intensity aerobic exercise. The 3 exercises we have described do not exist in isolation in the Japanese cultural context. The dietary principle most directly relevant is the Japanese practice of eating to 80% satiety, the Hara Hachi-bu principle practiced widely in Okinawa, which naturally avoids postprandial blood pressure elevation from large meals. The Japanese diet rich in fish omega-3 fatty acids, seaweed-derived minerals, and fermented soy products also creates a dietary environment that amplifies the vascular benefits of the 3 exercises. Nattokinase, derived from the Japanese fermented soybean product natto, deserves specific mention. A randomized controlled trial published in the journal Hypertension Research found that nattokinase supplementation produced significant reductions in systolic blood pressure over an 8-week period, attributed to its fibrinolytic activity reducing the subclinical microclot burden in small vessels and improving arterial flow characteristics. Natto itself, available at Asian grocery stores across the United States, provides this compound in a traditional food form that also delivers vitamin K2 and probiotic cultures. The integration of these dietary elements with the 3 exercises creates the comprehensive vascular environment that produces the remarkable blood pressure and longevity outcomes observed in Japanese populations. Now let us talk about how these three exercises work together synergistically. Isometric hand grip training primarily targets the sympathetic nervous system, reducing the chronic sympathetic overactivation that produces resting vasoconstriction. Slow resonant breathing primarily targets the parasympathetic nervous system and the baroreflex, enhancing autonomic cardiovascular regulation. Low-load, slow-tempo resistance exercise primarily targets the endothelium and arterial compliance, producing structural improvements in the vasculature that reduce peripheral resistance at the level of the arterial wall itself. 3 mechanisms, 3 exercises, each working through a distinct biological pathway, each producing independent documented blood pressure reductions. Research published in the Journal of Physical Therapy Science, drawing on data from Japanese adult fitness programs incorporating elements of all 3 exercise modalities, found that a combined protocol produced average reductions in systolic blood pressure of 12 to 16 millimeters of mercury over 12 weeks of consistent practice in hypertensive adults over 60. 12 to 16 millimeters of mercury, without pharmaceutical adjustment, without dietary change, through exercise alone. Setting realistic expectations for what these exercises will produce, and when, matters for sustaining the practice. In the first week, most people notice the slow breathing component producing immediate effects, a sense of calm and reduced heart rate. Some people notice a reduction in morning blood pressure readings within 3 to 5 days of beginning. The isometric hand grip and low-load resistance components require 2 to 3 weeks of consistent practice before measurable blood pressure changes become apparent. By weeks 3 and 4, the majority of people who have practiced consistently, at least 5 of 7 days per week, will have documented a reduction in average morning systolic blood pressure of 4 to 6 millimeters of mercury from their baseline. By weeks 8 to 12, the full benefit of all 3 interventions is typically established. The time frame in which the clinical trials documenting 12 to 16 millimeter reductions conducted their primary outcome measurements. The practical protocol. Begin with slow breathing for 10 to 15 minutes of 6 breath per minute resonant breathing. Follow with isometric hand grip training. 4 2-minute sets alternating hands with 1-minute rest periods. Conclude with low-load slow-tempo resistance exercise. 3 sets of 20 to 30 repetitions at light load. Total time, approximately 25 to 30 minutes. For adults managing blood pressure with medication, communicate your practice to your physician and monitor your readings carefully. The combination of these exercises with antihypertensive medication may produce blood pressure reductions that require medication adjustment, and that adjustment, made appropriately, represents precisely the outcome the exercises are designed to achieve. The Japanese approach to blood pressure management in older adults reflects a broader cultural orientation toward the integration of simple, repeated, structured daily practices into the rhythm of life as a form of health maintenance. Ragyo Taiso at 6:30 in the morning. Slow breathing before the workday begins. Light exercise incorporated into the daily flow without drama or equipment. The research validates this orientation, not because Japanese people have different physiology, but because these practices work at the level of vascular biology in ways that are universal, and because the simplicity and repeatability that the Japanese cultural context normalizes are the exact behavioral features that determine whether any health intervention produces lasting benefit. Start tonight with the slow breathing. 5 seconds in, 5 seconds out, 10 minutes. Then tomorrow morning, add the hand grip exercise. By the end of the week, add the low-load resistance component. Measure your morning blood pressure consistently. Let the data tell the story. If this video gave you a specific, research-backed exercise protocol for blood pressure that your doctor has never described to you in this level of detail, please support this channel. Hit the like button right now, subscribe so you never miss a video, and leave a comment below. Tell us what your starting blood pressure is if you are comfortable sharing, and which of the 3 exercises you are going to begin with. We read every comment, and your experience with this protocol matters deeply to this community. Japan figured this out decades ago. The research has confirmed it. The exercises are waiting for you. Thank you for watching. We will see you in the next one.